Hi there, my name is Dr. Tamarah Duperval-Brownlee, and I serve as the Chief Executive and Chief Medical Officer for Clinical Systems for Lonestar Circle of Care. And I wanted to be able to share a bit about our experience with patient-centered medical home. Our process to do it, which occurred about 3 to 3.5 years ago, was an incredible transformative process for us. What I think we're most proud of in the process of achieving the designation was not really the designation itself, but I think an opportunity to establish and concretize what the culture is of Lonestar Circle of Care, which I think is what the spirit is of achieving patient-centered medical home designation. It's an opportunity for those who are leaders, perhaps administrators of an organization, to be able to lay out a vision about how they would like to see the services being able to be executed in their institution, but it really provides an opportunity for providers, clinical support, those who are on the front line and actually providing the care, delivering the care, or ensuring that the care is done well and right, that it's done at the right time, at the right place, and in the right way for the patients that they're serving to actually be done. The opportunity for us to establish forms by which providers and medical assistants and front desk staff could actually talk in a language that was mutual, so that they can do things the same way and that people could understand each other across the table, was probably the most valuable thing we were able to establish here at Lonestar Circle of Care. We have a culture in our organization that is varied. It is really articulated by the word innovative. And we took that spirit in the opportunity of achieving patient-centered medical home designation because no one else was doing it around us, to be frank. As a matter of fact, in all of Texas, there are only 4 federally qualified health centers that have the patient-centered medical home designation. And our CEO said, well, it's something that we probably should be doing. Nobody else is doing it, therefore we will. And that's been always the mantra of Lonestar Circle of Care since our beginning 10 years ago, and I imagine it's going to continue in the next 10 years. So I encourage you, whoever's watching this right now, from the CEO of an organization to someone who may be taking care of facilities, that it's worth the investment. Again, not the focus on the designation, but I think with all the other jewels and value that can come out of it in terms of bringing together your organization towards a common goal, and that really is the person who you're serving at the end of the day. So it will be hard, it will be challenging, there'll be times that you'll be frustrated, but there'll be times that you'll have great reward as well, from the implementation of electronic health record to the opportunity of being able to capture what you already do so well and that you have confidence in. It's worth it. So take the time, do it right from the very beginning, but allow yourself to be able to enjoy that process and document and share with others your experience, especially the values that you're taking out of it. Best wishes to you.